it's a program package to, of course, enlighten us that which we seek in abroad, that which we seek in other countries is already with us here, and we really don't have to go that far in search of medical services. Any kind of treatment, any kind of disease, Nigeria has the capacity of handling it, and there is no need for you to travel. When you do so, you end up developing, contributing to the GDP of other countries. Why don't we put our resources together here, encourage scientists, medical scientists here, encourage the system here, encourage Nigeria's economy. Well, on today's edition of the program, we shall be looking at one very serious disease, sudden death, and the need for medical checkup. It happens, and people begin to run up and down, people begin to cry, people begin to, what happened? Some say maybe it's an arrow somewhere from the village. It is not. If you stay with me on the program today, your regular consultant orthopedic surgeon with Asokoro General Hospital, and also the medical advisor at Alliance Hospital. Of course, Alliance Hospital is one hospital that we definitely we are grateful to for most time giving us the appropriate personnel to discuss some issues regarding health. And I have with me Dr. Christopher Otabor. Very good morning to you.
Morning. Thank you for having me.
We're looking at sudden death and the need for regular medical checkup. Yeah. Let's start with sudden death.
Okay, thank you. If you watch the television or listen to the news recently, you would have observed that quite a number of eminent personalities have been dropping dead, you know, members of the House of Representatives, members of the Senate, other highly placed individuals.
Speaker.
Yes, and the reason you hear about them is because of their prominence. But for every one prominent person that you hear that dropped dead, there are so many hundreds, if not thousands, that also die, you know, without people getting to hear about them. So I think that's why this topic is important for us to look at the issue of sudden death. Someone who is not expected to die wakes up in the morning or does all his activities and maybe get home and suddenly slumps and dies, or slumps in the office, or even attending a meeting and he slumps, and people ask why. The truth is that something may have been going on without such people knowing. And that's why it's good to also tie this topic to a regular medical check. Yes. Now, there are three organs that, if they malfunction, can result in the demise of the individual.
What are those?
Yes, almost immediately. We have the lungs, we have the heart, and we have the brain. And if any serious insult to any of these three organs is unforgiving, it will more or less lead to the death of the individual. For the brain, like yesterday, a patient was rushed into my hospital and he had a massive stroke, and he passed away this morning because he was deeply unconscious. He had been diabetic for many years. The blood sugar was quite high, and he's also hypertensive. Those are risk factors for stroke. When the stroke happens, what happens in the brain is that a part of the blood supply to that part of the brain is cut off, either due to a blood clot forming inside the blood vessel, or the blood vessel can rupture. And if the blood vessel ruptures, that part of the brain will not get nutrients, will not get blood supply, and so it dies off. And if the part of the brain is large enough, then it will compromise vital functions, and that will lead to death. So most massive stroke anywhere in the world will lead to death almost instantly, or maybe a few hours after.
That is, even in stroke, there are classifications?
There are classifications. There are minor stroke, their intermediate stroke and their major stroke, and it's also classified based on the part of the brain that is affected. That's why some people will lose speech during when they have stroke. Some different things will happen, and if it happens on the right side of the brain, for minor ones or intermediate ones, that will not lead to death. If it happens on the right side of the brain, the left side will be paralyzed. If it happens on the left side of the brain, the right side of the body will be paralyzed. So stroke is one major cause of sudden death, massive stroke. Then another one is heart attack. That's the general term, but we call it cardiac arrest.
Cardiac arrest, of course.
Yes, when the heart stops suddenly, and things that can cause the heart to stop. When we have the blood vessels that is supplying the heart, although the heart is the one that pumps blood to all the body, but the heart itself also needs its own blood supply. And when that blood supply is cut off, either by narrowing of the artery or some blood clots in the artery, it can the muscles of the heart that pumps the blood would die, and so the heart muscle will not be able to pump blood, and that can lead to the instant death. And what can cause it? The same complications of diseases: long-standing hypertension, diabetes that is not controlled, high blood lipids like cholesterol, all those things, they tend to block the blood vessels. Then the lungs, if there's a massive, what we call pulmonary embolism, is blood clot in the lungs, it stops the blood from the lungs from going into the heart, from where it will be pumped to the body. So these are the major organs that if it's majorly insulted, it can lead to instant death. Though every other organ in the body will also, in one way or the other, lead to malfunction that will eventually lead to death, but they will not cause sudden death.
Okay, now the major ones you talk about now, the diabetes and heart disease, what are the major causes?
Well, for most times,
look at that from here, and I know at this point our viewers would want to be attentive to this part, because it appears that very many people have diabetes or have one form of heart disease or the other. And so the line will be open just in case it touches where you feel you need more clarification. You can call and he'll be here to answer you.
Okay. Diabetes and hypertension are largely inherited diseases. We inherit the genes from our parents, and then lifestyle makes it worse or helps to control it, our lifestyle. So we have two types of diabetes, type 1 and type 2. The type 1 diabetes starts from childhood, but the type 2 starts from when we get into around the age of 35, 40 and above. Yes, and the type 2 is more common, and your control of diabetes will determine the quality of life you live in middle age and into old age.
Sorry. Let's go on.
Okay. For hypertension, it's equally, most hypertension is also inherited, and it also manifests as though the gene is in our bodies from childhood, but it's the high blood pressure or diabetes begin to manifest as we get older. And these are things that we call silent killers, because many times there's no manifestation whatsoever about the symptoms of the disease until it strikes. Many people who come to the hospital with complications, in fact, Hello? Okay, sorry. In fact, many people who die suddenly never knew that they were either hypertensive or diabetic. It happens. So that's why we always emphasize the need for regular medical checkup, so that whatever is there is found. So people come unconscious to the hospital.
Hello, sorry. Hello, good morning. Your name and where you calling from?
My name is Blessing. I'm calling from Abuja.
Okay, Blessing. What question do you have?
My question is that if somebody has this disease, how can she?
Okay, I'm talking about the signs and symptoms of the disease. All right, thank you, Blessing. Dr. Otabor will answer your question.
Okay, most times someone can have diabetes for a long time without even knowing that he has it. The same thing with hypertension. Yes, but as time goes on for diabetes, when it's now complicated, you have things like excessive urination, frequent urination with volumes, excessive thirst. One wants to drink water all the time, and sometimes there will be weight loss, but for some people they even gain weight, and you have wound ulcers that are refusing to heal, and sometimes there's abnormal sensation in the feet and in the hands. So that's telling you that it's getting complicated.
Okay, sorry, Doctor. We just have to respond to them. Hello, good morning.
Good morning.
Your name and where you calling from?
Samuel.
Samuel, you're calling from where?
I'm calling from Ghana.
Okay, calling from State 2. Quickly, what's your question?
My BP is almost 200.
Wow.
Then they advised me to do exercise and eating stuff. Look at the sleeping time and look at the eating time. I don't know.
Okay, Doctor.
BP of 200, that's severe hypertension. He needs to be aggressive.
Severe hypertension.
Yes, that's the kind of hypertension that can easily result in stroke if nothing is done. Yes, all those advice they gave him is okay. You have a balanced diet, avoid excessive salt intake, do exercise. But all those would not, they are not sufficient to bring down the blood pressure of 200.
What can be done? We will come back to that. Yeah. Hello, good morning. Hello, good morning.
Good morning.
Your name and where you calling from?
Good morning.
Good morning, I can hear you. What's your name and where are you calling from? Okay. Quickly, let's hear your question or comment. You can go on.
I'm having a body pain up and down. I have high blood pressure. I don't know the cause. I've been buying different types of drugs for body pain. It normally increase myself.
Okay. All right, we'll give you an answer to that. But meanwhile, we'll allow doctor to respond to some of these questions for some time. Say, let's give doctor 4 to 5 minutes to look at some of these. Even as your call is coming in, I'll pick it. But just let's allow him answer some of these questions.
The fellow with the blood pressure of 200, I believe that the systolic it will not go away just with those lifestyle changes. He needs to see his doctor, a cardiologist preferably, who will prescribe medications that will drive the blood pressure down. Then those other lifestyle modifications like low salt intake, exercise and all that can now keep the blood pressure low while still maintaining him on medication. They can tail off the medication if the lifestyle changes can help him maintain blood pressure at a normal rate. For high blood pressure, the cause, we have already said that is inherited. Nobody can.
But he also needs to see a medical doctor.
Yeah, you need to see a medical doctor, especially for the body pains. It depends on what his occupation is. If he's a mason who is always carrying things and being physically exertive, or if he's a sports person, he might be having the body pain. So, and then malaria is also a cause of body pain. He needs to see the doctor. They will need to run a test for him to know exactly why he's having body pain.
Okay, now this sudden death that, of course, is bringing us to diabetes, hypertension.
Yes,
and all of
those things are not only causes of sudden death. There are some people who have problems with the heart from childhood that is not manifesting on time. Like for instance, you remember Kanu Wanko, the Nigerian former footballer. He had a hole in his heart. Though he was playing football and doing everything, but when he was going to sign for Arsenal Football Club in London, they did a medical check and they discovered that he had a hole in his heart. Okay? If that was not discovered, one day he may have been playing on the field, he will slump and die. And that's how it goes. There are many people who have holes in their hearts. They move around, they are doctors, they are lawyers, they are office workers. They don't know. So, and one day with little exception, that can happen. Then also, there are some other conditions in the heart, that affect the muscles, the muscle contraction. So all those can also contribute. Then drugs. Currently, we have a lot of drug abuse. Excessive intake of drug. Remember the late Whitney Houston. She died of drug overdose. So those things.
Many other.
Yes, excessive alcohol.
Because when it happens to prominent people, and we get to discuss it. But it happens to many people out there, and which is why this program is created, to enlighten you that you really have to take very good care of your health because of issues surrounding. Hello, good morning.
Hello, good morning.
Your name and where are you calling from?
I'm calling from Katampe.
Okay, from Katampe. Quickly, what's your question? Hello? You said?
How often is it good for somebody to be going for a medical checkup?
Okay, it depends on the age. He's asking a very important question. How often is it necessary to go for medical checkup? It depends on many factors. One, the age. Two, family history. And three, history of diseases. Okay. For instance, for a young fit adult, once in a year from above the age of 30, once in a year is okay.
That's from 30 years.
Yes, but as you get older, the need increases. And then also, if you have, is someone's relative died of, let's say, breast cancer, for instance, maybe a mother or a sister died of breast cancer, the aggression with which to check to make sure there's no cancer is higher, maybe 6 monthly. If someone's father died of prostate cancer, and once you hit 40, you must do your prostate-specific antigen. I believe we'll have time to go into that, if not today, some other time. The anatomy of the medical checkup, what you are supposed to do, and why you are to do those things, the relevance of all the tests. Yes, but the average is once in a year for medical checkup, but it could be longer, it could be more frequent for older. Yes, and then it could be less frequent depending on how the doctor determines it.
Okay, now when we talk about cardiac arrest, is one aspect that many people are scared of, maybe because of treatment, and it's one of the leading cause of medical tourism. We have them in Nigeria. We have cardiologists in Nigeria.
Yeah, we
have them in Abuja. Yes, and I'm sure Alliance Hospital has.
The Alliance Hospital has cardiologists.
So how friendly in terms of cost?
No, it's not even costly. I mean, how much money can you put on life? Sudden death does not even give you the chance to go abroad. I mean, all the people that died that we see on television, they would have paid anything to fly. So it's not about the money. It's about cultivating a culture, a habit of knowing what your numbers are, knowing your state of health. The fact that you look healthy does not mean that you are healthy. Yes, you need to be sure. You need to check with the doctors.
You need to be certified.
Yes, like for instance, Alliance also has a wellness clinic where anybody can walk in and you do all the checks, comprehensive. You are given a clean bill of health. You know that you are fine. Then after 1 year, you come back again, you know.
Hello, good morning. Hello, good morning. Okay.
Good morning.
Quickly. Go on, I can hear you.
I'll be taking the drugs, the drugs. After taking that,
you need to see a cardiologist. You need to see a doctor who will check you and do some tests for you and to find out what is happening. Okay? You need to see a doctor. It's not a phone discussion. You need to see a specialist. Your BP will go down.
Okay, I'm sure that is clear. You need to see a cardiologist. It's beyond phone discussion here. If you are taking drug and it's not working, then you need to avail yourself.
You can change the medication, they can modify it, they can change the dose, they can change the timing of the drug. If you are taking other medications with it, they can check that. So there are many things to look at when a drug is not working. And if the drug is not working for one person, you can change to another
person. Hello, good morning.
Hello, good morning, sir.
Your name and where you calling from?
My name is Dr.
You are calling from where?
Abuja.
Okay, quickly, let's hear your question or comment.
Sir, I have some problem in my body. My body is just too hot inside my bone. I don't know, I've gone to the hospital. Then the hospital told me there's no problem.
Okay.
Well, it still has this much
inside his bone.
Maybe I don't know the kind of hospital he went to. Yes, I'm sure that there are grades of hospital and there are levels of specialists. There are some hospitals that are manned by people who are not even doctors. Then there are some hospitals that are manned by doctors, but they are not specialists. But if you come to a place where you have specialist orthopedic surgeon, I'm sure they will find out what the problem is and solve it.
Yeah, I think that does it for you. If you have pains in your body and you feel that you are not okay, you are not the way you are supposed to be, that means you need to avail yourself in a health facility. Hello, good morning.
Hello, good morning.
Good morning. Please, can you tune down the volume of the TV set? Tune down the volume of the TV set. Yes. Right. Your name and where are you calling from? What's your name? Anne. Okay, quickly. What's your question?
It's about my mother who is last year and is
okay.
So we have been taking her and when doctor said when
when the left brain is affected, the right hand will paralyze.
Right side.
And the right side will paralyze. And when it's right, the left side will paralyze.
so we have been taking her and like she can't get very well for now.
Okay, look.
Well, there's little we can discuss in terms of telephone conversation. Yes, but if I have the opportunity of seeing her, we would evaluate her and prescribe the appropriate treatment. But hepatitis B is a common problem, and that is also part of why we must do medical checks, because if you catch it early, you can give medicine to stop the liver from being affected. But if it's too late, then the damage would have been done, and there's not much that people can do. But if you come to a standard, if you go to a standard hospital, I'm sure your mom can be helped.
Yes, I recommend number 5, Madam Fashion. those area 11 Garki Abuja. That's where I think that people should go to. I have seen doctors, what do you call it now? I've seen serving and past governors there. I've seen serving and past lawmakers there. I've seen ministers there. I've equally seen a tomato seller there. So it's for everyone. And honestly speaking, it's cheap. It's a place that is very, very cheap when it comes to healthcare. No wonder the traffic there is really, really unimaginable. Okay, Doctor, before we go, your last word. Because as a coming in, what do we do? But even after the program, you can see, you can continue. You can call them even after the program. So many calls. Let's take maybe one last one. Okay. Hello, quickly. Your name, where are you calling from?
My name is
Your question. I didn't get that.
No, what's the question?
What's your question? Taking of tea.
No, taking of tea does not cause diabetes. Diabetes is caused by a genetic factor, but there are things that can make it worse. If you take excessive sugar, it can make it worse. But taking tea does not cause diabetes.
Okay, doctor, your final word in this, and your calls can still be coming in. We'll attempt to do after we sign out this.
Hopefully, I will have some time next week to talk about the various tests that can be done during annual medical checks and the reason for those tests. But I want to say that the very fact that you look healthy does not mean that you are healthy. You have to be sure. And we must cultivate the culture of going to check with the doctor to know what your statistics are, so that you can reduce the risk of sudden death or chronic illnesses that can make life uninteresting or unbearable as we get older. So it's important to check with the doctor. You don't have to be sick to come to the hospital.
But the more we have on the program today, sorry for those that were unable to pick your calls, but you can still call even after the program. It has been with Dr. Christopher Otabor, a consultant orthopedic, hospital, and also the Medical Advisor Alliance Hospital, of course, where we usually drag him from, where we usually tell him that, hey, doctor, this Saturday morning, please, you cannot have your complete number of hours you usually sleep. Please give us some time from it, and he most time obliges us, and this is why we're here to tell you must take very good care of your health. I'm Joseph Kadri. Until I come your way again,